Hello and welcome to Intelerad's booth this RSNA 2011. My name is Rick Rubin. I'm the co-founder and chief engineering officer here at Intelerad Medical Systems. Intelerad is a distributed radiology solutions provider. We have all kinds of clients, but where we really excel is with large, complex, distributed radiology reading groups. Today we've got all kinds of new stuff to show. We've got InteleSuite, which is our complete RIS/PACS solution, InteleOne 2012, which is the advancements that we've made over the last year for all of our clients in distributed environments. And there's no way we can possibly show everything that's new in this short segment. So what I want to focus on is our solution to one of particular problems that we have, that all of our clients have, and that is collaboration. And this is a problem that started with the end of referring physicians coming to see the radiologist to see the film, and has only gotten to become more challenging as radiologists cover greater geographic regions, have to work with people in different buildings, different states, different countries, and we even have clients collaborating across continents. And so we've developed a whole bunch of functionality and tools to help radiologists and other people involved in the patient healthcare to collaborate and work together so that patient care is improved, and also creating greater efficiencies. Because one of the things that is common to all of our clients, especially in the InteleOne world, is even in these very challenging times, they've all gone through significant growth and at the same time achieved economies of scale without having to increase their radiologist headcount proportional to that growth. So let's turn over to have a look at the software, and we'll go through some of these new benefits. The first place that collaboration begins is with the radiologist work list, and a radiologist is quickly able to see at a glance all the work that is about to be ready for them to read, what is ready for them to read, what they have dictated, and then outstanding critical results, which we'll cover a little bit later. This list can be tailored and filtered. So for instance, if I just want to see studies that have been assigned to me, I can see that. And as soon as I log into here and I launch this case, you can see that this patients folder is opened. I can see the images, and if I was in the middle of my read and I wanted to actually consult with another radiologist, I can actually directly from the images create a consult request with a colleague of mine. So we filter down to only the other radiologists who are online at the moment. I can see their specialty, so if I wanted to get a particular specialty online, I can message them, it sends them a link to the images, and then they can call up the images directly. At the same time, if I didn't want to necessarily look for somebody who was online, I can send offline messages. So we have a messaging tab. We can see all the radiologists who are online. I can also look at radiologists who are offline, send them a message, and when they log in, they'll get a prompt saying, can you please have a look at this case and give me a call back. And then from here, I can also talk to referring physicians, technologists, transcriptionists, and all the other people that I need to collaborate with during the course of my day. Another form of collaboration is with peer review. Right now, this case has been flagged by our peer review system, telling me that this prior, for whatever reason, it's requiring a peer review because either quotas for me or for the reporting doctor or for this procedure are not meeting our quotas. So it requests that I do a peer review. I can send this, I can concur or not, provide feedback to the other radiologist, and they'll get a message saying that I've peer reviewed their case, although it's all anonymous, so they just know that there's been a peer review. And if I didn't want to do this right now, I can push it onto a work list and come back to it later. And then this allows basically for radiologists to collaborate in a way that's really efficient because it's embedded right into their workflow, and then increase the quality of care through collaborative type of work. So if we go back to the patient record tab, one other aspect of collaboration is now between radiologist and referring physician. If I found that there was an emergent finding here and I wanted to flag it as a critical result, I can select what the issue is, which automatically creates a priority level. I can pick up the phone and make the call myself and record that here. I may want to just finish up the case and make the call, so what I can do is I can push it onto essentially a to-do list. So if I do that right now, click here and close the case and mark it dictated. In my critical results tab, I see that I have one outstanding critical result. And there's a timer on this, so as it starts getting closer to my threshold of turnaround time, actually 60 minutes is pretty long for a pneumothorax, but this will start to go red and I'll start getting prompted. In the meantime, as soon as I've signaled that flag, a message has been sent to the referring physician through our InteleConnect portal. We also have an Apple iOS device application that will also notify them that there's a critical result, which they can open up and they can acknowledge. So before I may even call them, they may see this response and acknowledge it, which would also show up here. So instead of the status being to be called, it would show as being viewed by the referring physician and acknowledged. So I may not actually even end up having to pick up the phone. And we have various levels, so it's not just for the most emergent type of findings. It could be things that just are important to talk to the referring physician, but doesn't have to be done at this very second. So we've now just been talking about what the radiologist, from their point of view, and so now what we're going to do is have a look at what the referring physician would see in the case of a radiologist having created a critical result notification, or whether or not they've been notified that there's a report ready for their exam. So this is InteleConnect, which is a web-based portal, zero footprint, so it can run on any kind of mobile device, on a browser, obviously on Windows, Mac, Linux. And so this is basically a series of notifications. We give thumbnails for images, so you can immediately just catch your eye in terms of what kind of case is being notified for. And if I open up one of these, immediately we bring images and the report. Actually, in this case, there's no report yet because it's just the critical result. But I can actually see that and acknowledge it. And when I do that, that message gets sent back to the radiologist work list that we saw before. This is basically a very simple viewer. The point here is not to have a really complicated viewer, but to make something really easy for the referring physicians to use. No training. Basically, they're up and running immediately, and the response so far has been referring physicians love this kind of functionality. At the same time, since I'm logged in as a reporting radiologist, I can see that I'm online, or the referring physician can see that I'm online, and initiate a chat session immediately from that point. So I will be prompted with an instant message prompt. Most of the time it's really just call me, but they could actually initiate a chat session through here. So we added some macros to be able to ask for phone numbers, be able to launch the case so that the radiologist gets a link to it, because they're probably not looking at the case anymore. So they immediately click the link and it brings them right to the images, and then they can have their consult over the phone. So all in all, this is basically a huge time saving. I mean, the amount of time rads spend trying to hunt down and get in contact with referring physicians has all been totally streamlined with this product that we're showing here today. Thank you very much for spending time with me at our booth, this RSNA. For more information, please contact one of our sales representatives or visit us at intelerad.com.